I'd like to take you back to a small kitchen table in Chicago. It's 2008, and at that table sat my mother, Tracy Alston, and a small group of First Ladies. For those who don't know, First Ladies are the pastor's wives of churches. These are women who spend every week walking alongside families with their greatest joys and their deepest challenges. Together, they wrestled with a question that felt almost impossible. How do we protect people from a disease they're too afraid to talk about? At that time, HIV was devastating the Black communities across the nation. The science existed, the testing existed, the treatment existed, but in many churches, the conversation didn't. Silence had become its own barrier to care. So those women that day made a decision. If they were going to ask their congregations to get tested, they would go first. That following Sunday, across Chicago, those First Ladies stood beside their husbands and publicly received HIV screenings in front of their congregations. Not because science needed proving, because community trust did. And that courageous act became the beginning of the First Ladies Health Initiative. But what inspired me the most is it's not just a model, it's just one simple belief. When trusted leaders lead, communities follow. 2 years later, my mother brought that vision here to Los Angeles. She wasn't coming to build something from scratch. She was coming to make partners. Leaders who believed that faith communities could do something very powerful when allied with health professionals in Black and brown communities. And she found them. One of them was Dr. Betty Price, First Lady Emeritus of Crenshaw Christian Center. Another, Dr. Cynthia Davis, a loved faculty member here at Charles R. Drew, who also serves on our board. They both knew that health equity, in order for genuine partnership to exist, that we needed to marry the community with academic research. So when I look around and I see everyone, I don't see a new partnership. I see something that's been building over 15 years. Relationships built by people who understood that lasting change doesn't happen when institutions work for communities, it happens when institutions work with communities. So this isn't our first chapter, it's the next one. And I have the privilege of sharing that next chapter with you. I'm Marquise Austin. I am the co-executive director of the First Ladies Health Initiative. And I just want to say it's an honor, Dr. Sherzai, and to be here with Charles R. Drew and everyone in the room, because tonight isn't about launching another thing. It's about something bigger. Over the last 18 years, whether the issue was HIV, diabetes, hypertension, maternal health, and brain health, I've watched us ask the same question. How do we get better health care into our communities? And it's the right question, but it isn't the only one. Because I believe there's a deeper question. How do we strengthen the communities that make better health possible? And the answer is the same every time. The greatest health resource in every community isn't something waiting to be created, it's something waiting to be connected. People often ask what we do with the First Ladies Health Initiative. Yes, we provide screenings. Yes, we bring hospitals, institutions, and physicians together. But if that's all we did, we just host really great events. Our mission has always been bigger, to leave every church stronger than when we found it. Because when you strengthen a church, you strengthen the community around it. Churches are so much more than buildings where we go on Sundays for worship. They're where children discover their gifts, where neighbors become family, where wisdom passes from one generation to the next. And perhaps more importantly, they are one of the few institutions that walk beside people over their entire lives. A research study, lasts a few years. Hospital care lasts through your season of illness. A church walks beside a family for generations. That's not a venue or a location. That's relationship. Built over decades, long before anyone ever needed it. And what I love about church is every church has those healthy ingredients. Somewhere in every congregation, there's a physician or a nurse or a therapist or a public health professional. People who spend their careers caring for others who may have never imagined that those gifts could be served right there in their church ministries. Our role as First Lady's Health Initiative is to bring those gifts together. The First Lady becomes the champion, healthcare professionals become the trusted resource, researchers become neighbors. Today, the First Lady's Health Initiative has more than 150 churches in our networks and health ministries, alongside more than 250 partners. And together, we've touched more than 700,000 people. Not because we built something extraordinary on our own, but because we connected what was already there. My belief, don't create it, connect it. And over those years, I learned something that really changed me. We often assume people avoid healthcare because they don't care about their health. That hasn't been my experience. The people we meet care deeply. Sometimes they care so much about everybody else, they stop caring for themselves. We've met mothers who tell us, I can't afford to find something wrong with me. Fathers who say, too many people depend on me. Caregivers already carrying the weight of an entire family, so they make the impossible bargain. They convince themselves that not knowing is safer than knowing. Except the thing about illness is, the disease doesn't disappear just because you don't know. It simply waits. That's why where we meet people matters. When healthcare asks someone to walk in a place they already fear, like a hospital, fear often wins. When healthcare shows up where people already feel seen and known, where the First Lady knows their name, where the usher greeted them at the door, where they've worshiped for years, where their children grew up, something shifts. I think about a woman who stayed after Sunday service for one of our health fairs. She wasn't there because she had an appointment or something was wrong. She was simply at church. She sat down for what she thought would be a routine blood pressure screening. The cuff went off. The numbers came back. Her blood pressure was so dangerously high that an ambulance had to be called. She had no symptoms, no warning. She was just maybe hours, minutes away from a stroke. Think about that. A simple blood pressure cuff in a church fellowship hall caught what years of everyday life had missed. And she wasn't saved because healthcare waited for her to come to it. Healthcare came to where she already was. And that's the power of community trust. And sometimes it saves lives. But community trust can be broken. And in our communities, it has been, from Tuskegee to 100 other quieter betrayals. Our people were given every reason not to trust the institutions that claim to heal them. And that mistrust is not paranoia, it's earned. So when a community does trust you, that community trust is not yours to be taken for granted. It takes decades to build and a single broken promise to lose. It's one thing that turns a discovery into a changed life. And watching those many moments of health fairs and the things that happen there changed the way I think about public health. But they also changed the way I think about leadership. People sometimes ask how I came to lead First Lady's Health Initiative if I saw myself always doing this work. And I answer honestly, no, I did not. Neither did my sister, nor my sister imagine that we would be running this organization at this stage in our lives, but we are here. But looking back, I realized I was being prepared long before I knew what I was being prepared for. I didn't just grow up hearing about the work, I grew up inside of it. While other kids spent their time, their summers at camp, I spent mine working alongside my mother. Looking back, I realized I was getting the kind of education no classroom could ever teach me. By the time I was 12, I was calling in payroll, I was helping organize community events, and I was building Get Out the Vote campaigns. I'm sure child labor laws would not approve of that, so don't tell them. My mother taught me something that I carry with every day. Relationships are built long before you need them. And that's a lesson that followed me everywhere. At Spelman College, I learned that leadership isn't about having answers. It's about helping people believe that they could solve problems together. On Capitol Hill, where I worked, I learned that policy shapes opportunity, but also just as important, it also taught me that policies don't implement themselves. Communities do. So, I went to where the change actually began. As an organizer for Obama for America stationed in Indiana, I knocked on doors where I listened more than I talked and learned that lasting change rarely starts inside a government building. It starts on the front porches, in the living rooms, one conversation at a time. At 22, I did this crazy thing where I ran for Illinois State Senate. I lost miserably to a very popular NFL player. But honestly, I'm very happy that I did, because that loss forced me to ask the question of what kind of change maker I wanted to be. And I realized I didn't want to spend my life only changing policy. I wanted to spend my life changing how people think. Because when you change how people think, you change how people live. Information alone rarely changes behaviors. Stories do, connections do, community trust does. Every one of those chapters of my life taught me something. Community trust is not soft. It's how ideas move. It's how communities move. It's how healthier futures get built. My mother started this work with an idea, and I'm grateful I don't get to carry it alone. My sister Taylor and I lead the First Lady's Health Initiative together as co-executive directors. Just two Spelman women raised inside this work. We are not the same kind of leader, and that's exactly the point. I learned to move people through conversation. Taylor, an award-winning market strategist, learned to move people by the thousands, how messages travel, how to carry a movement far beyond the walls of a church. I know how trust is built. She knows how it scales. Together, we don't preserve what our mother built, we prepare for what's next. And then something life asked of us that no strategy could prepare us for. There's one lesson in all of this that I wish I never had to learn. In 2021, my mother was diagnosed with early onset Alzheimer's disease. She was only 60 years old. The woman who had spent decades telling people to know your numbers, ask questions, get screened, take ownership of your health, suddenly our family became the family navigating a diagnosis. Over the next few years, we watched Alzheimer's slowly change the woman that we loved. By 2024, she was no longer driving. She no longer carried a cell phone. The woman who had spent her whole life helping communities remember what mattered most slowly was losing pieces of herself. On February 25th of this year, she passed away at just 64 years old. Alzheimer's didn't just take my mother from our family, it took a leader from our community. And there are thousands more just like her. Today we know that Black Americans are nearly twice as likely to develop Alzheimer's than their white counterparts. Hispanic communities also face disproportionately higher rates, and nearly 2/3 of those people living with Alzheimer's are women. Those aren't statistics. They're mothers, they're grandmothers, they're first ladies, they're caregivers. They are brilliant minds that our community still needs. We often say that our work begins by listening, not listening to what researchers want to study, listening for what the community is asking us to solve. That's why every new chapter of the First Lady's Health Initiative began the same way, by following the voices of the people we serve. And that's the last mile. It's the distance between discovery and community trust, between evidence and action. And that's where the First Ladies has found its purpose. We don't replace science. We help science off the page and reach people it's meant to reach. And that is exactly what brings us here tonight, because our partnership with Charles R. Drew and the Impact Program isn't an idea, it's already happening. Through Inspire Faith, Dr. Sherzai and his team have already shown what's possible. At Crenshaw Christian Center, more than 150 neighbors are enrolled, proof that the research can begin at the very places that people already trust. What the First Ladies Initiative brings is how to grow it. Because one church can prove a model, it takes a network to change a community. So we are bringing more First Ladies and more congregations. Each door is opening because someone that they trust opened it first. So what began as a small kitchen table in Chicago now lives in Los Angeles, Sacramento, Orange County, Atlanta. And together with Charles R. Drew, we intend to take it national. Imagine this model. In every city that looks like ours, the trust of the First Ladies join with the rigor of first-class, world-class research, carrying the best science we have straight into the homes it has never reached. Detroit, Houston, Carolinas, you name it. A national network, proof that when community and science finally build together, lives change. That is a collaboration we came here to begin. For generations, we have asked our community to trust science. The next step and the next chapter asks something more of all of us. It asks science to prove itself worthy of their trust. My mother spent her life connecting people to hope. My sister and I inherited the work of connecting trusted communities to life-saving science. But that work does not only belong to us. It belongs to everyone in this room. Because the last 18 years taught me anything, is that the greatest health resource in the community isn't something waiting to be created, it's something waiting to be connected. So let's stop asking communities are they ready for science, and start asking whether science is worthy of the communities it hopes to serve. Thank you.